Chronic kidney disease is a long-term condition where the kidneys do not work as well as they should. So in this video, I'll provide you with exercise advice if you're suffering from it. Hi everyone, and welcome to Exercise for Health. And if you have chronic kidney disease or are at a high risk of developing it, for example, you have a known risk factor such as high blood pressure or diabetes, then staying active as part of a healthy lifestyle can help you manage your symptoms or may even prevent it. Research suggests that getting the recommended 30 minutes of low to moderate intensity exercise a day on 5 days of the week will be good for you, and it's even possible to maintain exercise during any dialysis treatment. However, the time and intensity of the exercise you choose will be partly influenced by how severe your chronic kidney disease is and what you feel that you're able to do. Exercising for 30 minutes 5 times a week may be daunting for some, but even trying to maintain a more physically active lifestyle, such as choosing to walk rather than drive for short journeys, or being more active around the home with household chores, can all add up to improving your health, making you feel better. If you have mild to moderate chronic kidney disease, your physical ability should not be reduced and you should be able to exercise as often and as vigorously as someone the same age as you with healthy kidneys. This means exercising for at least 150 minutes a week, combining aerobic exercise such as walking, jogging, cycling, swimming, playing a round of golf or gardening, with strength activities such as going to the gym, carrying bags of shopping or doing a Pilates class. In addition, time can be spent doing some light stretching exercises to help you maintain your mobility. Doing this level of recommended exercise each week will not only help you manage your symptoms, but it will also help you manage your blood pressure and blood glucose levels, as well as bring you all the other benefits that regular exercise gives, such as improved sleep, more energy, improved mood, as well as feeling fitter and more able to carry out daily activities. If your condition is more advanced or you're already on dialysis, your ability to exercise is likely to be reduced and you may feel weaker, become breathless and tired more quickly. However, exercise will still be beneficial. If you're at this stage, then it's worth checking with your doctor to get individual advice on what action will be best for you. But it could be that taking part in a program similar to those undertaking cardiac or pulmonary rehabilitation may well be suitable. But this will be dependent on how the condition affects you on a daily basis. You may be someone that feels you're unable to conduct any exercise, but even a small amount of movement will be better than nothing, and it will help with preventing functional deterioration. You could try doing some light exercise for just 10 minutes at a time to see how you get on, and then progress the amount of time when you feel that you can. If you are able to take part in some form of regular exercise, then the following recommendations should help you formulate a plan. Firstly, it's better to start with lower intensity activities, so as your tolerance improves, you can gradually progress the level of intensity. For people that are very deconditioned, starting with some lower level therapy-based exercises that are very light in nature, such as seated mobility movements with a light resistance band, may be more beneficial before starting any cardiovascular activities. During any form of exercise, always keep the rate of perceived exertion scale of 0 to 10 in your mind to monitor your intensity level. Try to stay within the range of 4, 5 or 6 during the main exercise component after gently warming up and before cooling down. More vigorous activity may well be tolerated by individuals that have the mild to moderate form of the condition and that have also developed a good level of physical fitness and conditioning. Ensure that the optimum time is spent exercising, which will vary from person to person, to ensure that an increased level of fatigue doesn't inhibit exercise motivation levels, but also to consider the time demands needed for any dialysis treatment. Some people at risk of stress fractures as a result of their medications or treatment should avoid high resistance or high impact exercises or movements. Ensure that your resting blood pressure and blood glucose levels are well controlled before conducting any form of exercise. This means that your blood pressure should be well below 180 over 100, and your blood glucose levels, if you're diabetic, should be between 5 and 12 millimoles per litre. And finally, it's important to listen to what your body is telling you and not to do too much. Overall, the goal of any exercise program will ultimately be to improve your quality of life and help you manage your symptoms. So above all, choose something that you find manageable and enjoyable. If you feel able enough to try some of the home exercise programs that we have on this channel, then I'll leave a link in the description below to our playlist so you can pick one that will be the right level for you using the intensity scale on the thumbnails. I hope the information provided in this video helps guide you to some form of exercise that manages your chronic kidney disease symptoms. If you found it useful, please give it a like by clicking the thumbs up button below and consider subscribing if you haven't already. You can also check out the description for ways that you can help support this channel. But thank you so much for watching, and until next time, stay active and keep moving to feel better.